Hello, everybody. Thank you for joining us today. This is going to be Pet Partners Facebook Live about zoonosis and how germs transition between people and animals. If you have just joined the stream, send us a little note in the comments. Tell us where you're from. Tell us who you're watching with. If you've got a four-legged furry friend who's joining you, we'd love to hear about them. My name is Mary Margaret Callahan. I'm the Chief Mission Officer at Pet Partners, and I am delighted to be joined today by a member of our Human Animal Bond Advisory Board, Dr. Zenny Ng. Zenny, you want to introduce yourself?
Hi there. Yeah, thank you so much for having me, Mary Margaret. I am so excited when you asked me to be a part of this, to come and join in on this. So I am a veterinarian, and I'm a faculty veterinarian at the University of Tennessee. And so my main care is delivering care and teaching our veterinary students how to be small animal practitioners. And at the same time, my heart is in everything related to the human-animal bond, and especially animal-assisted interventions. So we do a little bit of research on both the humans and the animals as a part of that human-animal bond, and it's super exciting to do that. And I love being a part of Pet Partners as well. My previous golden retriever was a proud and true Pet Partners pup for forever and ever, and so it's really a great thing to be a part of this wonderful organization.
Well, we're really glad to have you today, and I'm so pleased that we've got somebody with such great veterinary experience here to help answer questions as they come up. So as you join, drop us a line, say where you're from, tell us what your pet's name is. Zenny, you have any pets right now?
I do. So I'm in my office at school right now, and I have a cat who might be.
I think I can see her. There she is.
But as she is eating right now in front of that fish tank. And then over here, down below, I have Drizzy, who is passed out. Driz.
Hi, Drizzy.
Come over here. And so that is him. And so he hangs out here. And he is not a pet partner just yet. He's about 4 years old. I got him as a rescue, and we're still working on some things. But
nice.
A good dog. And the cat's name is Sunshine. She's about 8 years old, and she also came as a rescue. And so they both come and help me kind of teach the students and do everything about the human animal bond and teaching various things in class. So it's always
fun. That's awesome that you get to bring some pets to work. Yeah. I can bring pets to work too. I don't have any with me today, but I've got a whole truckload of them back at home. I've got 3 dogs, 2 cats, 8 goats, 3 miniature donkeys, and 2 guinea pigs, and a bunch of chickens. But if you've just joined, tell us where you're from. Let us know a little bit about your animals. Share this, let people know to join. But we're really excited to, in the next minute or so, get started talking about, oh, look at their Sunshine. You on the straight and narrow. Good job. We're really excited to start talking a bit about, germs and how they spread and how our pets are part of that. It's important, I think, especially anybody who's been paying attention in the media, you know that infection prevention is top of mind for everybody right now. So we're going to have lots of good things to talk about in the next bit. Oh, look, we've got a bunch of people who are joining. Diane from New Hampshire, a border collie. I had a border collie when my husband and I first married. You must have as much energy as that dog. Congratulations. Hi, Kathy with a golden retriever. Another golden retriever out of New Mexico. Hi, Sarah. Thanks for joining us. We're glad you're here today. So we've met Zenny and his 2 teaching assistants in his office today. And we're going to get started just about now, starting talking about infection prevention and control. So infection prevention has always been a high priority for Pet Partners. And I think it's reasonable to point out now, whether you're a therapy animal team visiting with Pet Partners or someone else, or whether you're just a member of the public or a responsible pet owner and you want to be thoughtful about how germs might pass between animals and people, That's what today's topic is really about. Obviously, for those of you who are following current events, so much talk about the coronavirus right now. But I think it's really important to point out that a lot of the precautions that we're going to advocate for when we talk about zoonosis in general are just as valuable for the common cold as they are COVID-19. And so we just want to underscore that through all the things we're going to talk about today, we're not just going to focus on one specific germ or disease. We're going to talk very broadly, but it's important to recognize that any of the precautions that we're going to talk about are useful for a wide variety of situations and scenarios. So let's see. Oh, we've gotten a bunch more people who have joined. Thanks for being here. Mike, nice to see you. Claire, welcome from Florida. Let's see. Oh, Miniature American Shepherd with Sue Louie. I love it. Welcome, welcome. Oh, gosh, tons of people here. We're so glad you're here. Amanda from California with your German Shepherd. Welcome. Oh, and I love Lori's here from Colorado with her mixed breed. Now, Lori, just hot tip. Sometimes we refer to those as BOABs, best of all breeds. So feel free to take that if you need to refer to your animal. All right, so let's go ahead and get started and talking really first about how is it that diseases, germs, things like that spread between people and pets. Now, Zenny, I'm under the impression that it's mostly through contact primarily. Does that sound right to you?
Yeah, I would say that most of the transmission of a lot of our zoonotic diseases that we talk about are basically by direct contact. So that is like kind of hands to the animal, hands to around like the mouth, the butt area, kind of the dirty bits that might be around in there. However, it really depends upon the actual parasite or bacteria or whatever infectious disease that we're talking about, because sometimes indirect contact, and as we talk about with all of our coronavirus, sometimes aerosolization and things like that can also play a part in that transmission as well.
So I'd love your opinion on this, because so we know like touching, your mouth, like, and I also, you read about if animals get, if you get a bite or a scratch, you need to clean that carefully to make sure you don't pick up germs in that way. But I see lots of really heartwarming, cute videos, particularly on Facebook, where people are like letting animals lick their faces and things like that. What's the story on potential risk for, if you really like to indulge in a bunch of doggy kisses?
Ooh, that's a tough one, because I know that there's lots of people, including, well, I don't usually make out with my dog, but I definitely get lots of kisses as a veterinarian, which is great and heartwarming, and all that part of like kind of the human-animal bond, what we love to really indulge ourselves in. However, we should also know that we should do it with proper precautions, or that we should just be knowledgeable about what happens when we're actually in love with our pets. Yeah. So it is very possible that if your animal is carrying something that is potentially zoonotic and that can be transmitted to you, probably face-to-face and mouth-to-mouth contact is probably the best way that's going to promote pollination and infection. And I think that it's rare that those things happen, because if you think about how many people actually kiss their pets and are intimate with their pets in that way, like it's very rare that we ever hear about any like bad side effects from those. So I think that as long as you are aware that to kind of keep things clean, if you will, then I think that you'll all be safe.
Excellent, excellent. So I'll just pause a minute to say hi to the people who have been joining us. We've got a whole bunch more folks who are here. Welcome, welcome, welcome. Nancy has got 3 golden retrievers in Maine. Congratulations to the person who just passed their evaluation this last weekend. We're glad to have you. We've got Diana from Puyallup, an English lab named Baxter from New Jersey. Welcome, Renee. So all sorts of great folks joining us. Thank you for being here. You'll see that we'll be posting comments from time to time with links and things. There's a great article or a great link to a general blog by another one of our human animal bond advisory boards. members, Dr. Scott Weiss, who writes the Worms and Germs blog that focuses on pets and germs. If you happen to be interested particularly in coronavirus things now, he's got several short blog articles that might be of interest to you. So feel free to check those out if you're so inclined. So we've been talking about how you get germs, usually through direct contact, through saliva, through feces, things like that. The other one that I'm always hyper aware of, and maybe it's because I have a 7-year-old daughter and she seems like she's always sticky, but I think about people who cough into their hand or touch something dirty and then go to pet my dog. Is it true that like a dog's coat can act like a vector in that way? If I go and pet a dog after someone who has dirty hands has pet the dog, should I be concerned?
Ooh, that's a great question, and something that we get asked about often. And with that being said, I think that we should be aware that, that there is the potential for that to happen. For that, if somebody is sick and they cough on their hands and they're petting a dog, and that dog might not necessarily be affected by it, but if they were to go pet another person who is not affected, if there's enough time for that bacteria or virus or whatnot to kind of procreate, if you will, on that surface, then it is possible. So just like when we talk about different bacteria and viruses that can live on different surfaces, so just like on plastic, on glass, on whatever else, it's very possible that animals can serve as that surface as well. So we just have to be wary about that and take the right precautions when thinking about those situations.
Absolutely. And all the more reason we'll talk about other sort of general precautions and hand hygiene in a moment. But, if we think about what kinds of germs or diseases can be spread by therapy animals or even pets in general, I think the one that most people will think of immediately is rabies, because people talk a fair bit about rabies and things like that. But there's lots of other things too, right? Parasites that we should be aware of, bacteria. I mean, what would you think are some of the ones that maybe are the most common?
With those zoonotic diseases, as far as most common, what I would say number one is probably least common that we have out there is rabies, since you just brought that up, is because I think that we're pretty safe and we follow the rules and regulations and laws that rabies isn't as much of an issue. However, at the top of my list of what I think that is most likely to be a potential are probably GI parasites and bacteria. So those things that we get our animals on monthly preventatives for, like heartworm prevention and intestinal parasite prevention. So those specific things like hookworms, roundworms, and whipworms, I think that those are very much prevalent, and especially when your dogs are visiting dog parks in those areas. In addition, I think that the other more concerning GI bugs that we often think about are things like E. coli and Salmonella, and Clostridium, because they are prevalent in our animals, and those animals might not have any clinical signs at all. And it's especially a concern if we are visiting hospitals and other sort of long-term healthcare facilities as well. So those are the GI ones, are the ones that come to mind, but obviously we can go on about the long list of them. And just to kind of mention, as far as skin goes, the things that people usually worry about are ringworm. So, and to remember that ringworm is a fungus. It's also called dermatophytosis, and not an actual worm. And also like just fleas and ticks, and just making sure that we are preventing against those as well. So those are probably the most common.
So prevention really is the name of the game. We've had several people commenting. I've been watching folks comment through, and you mentioned this too, Zenny. If you're visiting in a hospital setting or with people who might have compromised or suboptimal immune systems, being even more sensitized to that. I've had certain people mention here, like some hospitals don't allow therapy animals in the ER or the ICU. Absolutely the case. Different facilities are going to have to manage sort of their own risk and things like that. So very, very good points, all of them. And if you are somebody who's really interested in all the numerous potential diseases, the CDC has got a great website on their healthy pet section that you can look up by the type of animal you have, and it'll kind of lay out the different kind of things you have. So really interesting there if you're interested in knowing all the gory details about some of the things that Zenny mentioned. But really, we've talked about, to your point, there's preventative medications that we can take and things like that to make sure our animals are less likely to be having these things. And then there's preventions that we can take as people to lessen the chance that something will be transferred to us as a person with an animal who may be carrying something. And the obvious one, and if you've been on social media at all in the last week, people are talking about is hand hygiene, right? So much that we can do in terms of hand hygiene, best practices for washing your hands, go to the CDC. They are the #1 on this. But I actually saw something, I'm sure posted on Facebook at some point in time about how although recommended hand wash time is 20 to 30 seconds, most people only do about 5 or 6 seconds. So making sure that you're washing your hands thoroughly. Or using hand sanitizer, right? If your hands aren't visibly dirty, hand sanitizer can be a good option too, so long as the alcohol content is at least 60%. So I get this question from time to time, Zenny, and I'm interested in your opinion on it as a veterinarian. For people who are therapy animal teams and they're doing hand hygiene and offering people before they pet their animal to do hand hygiene before petting, should handlers be worried about transferring the transfer of, say, a hand sanitizer onto the coat of their animal if people have just cleaned their hands and then touched their pet?
Oh, with that being said, so if we think about when we get hand sanitizer on us and it's alcohol based, and usually it dries pretty quickly. So I would hope that under most situations you don't have sopping wet hands with a hand sanitizer and just like smearing it all over a dog. So hopefully just using a judicious amount of hand sanitizer that's going to be effective in getting rid of all of those germs, and making sure it dries before actually petting the dog would be great. But in general, I think that with that being said, with that hand sanitizer, I think it's a very good safety precaution, especially even though hand washing is probably better, is like the preferred modality in those instances when you're really engaged in animal-associated therapies and all of that. If you just have that bottle to the side, that's very responsible and an easy thing, and a very good practice to ensure.
Absolutely. So for anybody who's on the live now, if you're a therapy animal handler and you have some favorite ways of asking people to wash their hands or cleanse their hands before they interact with your animal, throw them up in the comments. We'd love to hear that. We recognize that sometimes when you're visiting a facility and somebody's super excited and they come to your animal and they really want to pet, it can be a little bit like, oh, hey, hold on, let's wash your hands first. And some people can find that a little bit straining or stressful to ask somebody else to clean their hands. So if you've got a great way that you like to invite people to perform hand hygiene before they pet, let's hear it in the comments. It will help everybody who may be a therapy animal team and could use a new tip or trick. So hand hygiene, we've talked a bit about. It's a great preventative measure. The other one that pet partners really ask people to employ on visits is to use a barrier, right? That if you have a small animal, whether that's a small breed dog, or maybe it's something like a rabbit or a guinea pig, something that you can hold, and you're going to set it next to someone or on someone's lap or on a chair or on a bed, we ask that you use a barrier. Is that mostly because of feet, Zenny? Is that why that's the most effective, or are there other things we should be aware of?
Yeah, because I know it might sound a little bit cumbersome or a little funny to be putting a blanket or this barrier on between a person and a pet, but I think that it is very important, especially in hospital settings, when we are putting that increased risk of like kind of zoonotic disease and contact. And there have actually been studies that have shown that there's an increased risk of transmitting specifically MRSA and Clostridium difficile to people if they are touching their pets, if they are touching therapy animals' paws. And I think that what we're finding is that as dogs are kind of walking through the hallways of these hospitals, they might get contamination with a lot of these like germs and particles on their paws. And so when they're put up on a hospital patient's bed, then obviously then they can transmit those germs to them. And so they said that they looked at those behaviors and pretty much touching their paws, taking treats, getting licked by animals were all increased risks of transmitting those diseases. So I think with that being said, I think it is very wise and a prudent practice to use those blankets and barriers.
Yeah, absolutely. Great. I'm just scanning back over questions and things like that. We did see a question saying that hand washing is not always practical, particularly if you have clients who maybe you don't have mobility and can't get up to a sink. So is hand sanitizer adequate? And yes, so long as hands are visibly clean. So if somebody already has muddy hands, hand sanitizer is not going to help you. And if they are adequate level of alcohol percentage, which is 60% or greater is what's generally recommended. So that's a piece about hand sanitizing that's definitely well worth it. And there are some advantages to hand sanitizer in this really portable, right? There's different kinds, and something to consider if you are a therapy animal handler and you carry hand sanitizer with you. There are so many different choices out there, but paying attention to whether you, your animal, and your clients prefer scented or unscented, the ease of applying it, like Zenny mentioned, being able to do just a small amount so you don't have soaking wet hands that it takes forever to get that to evaporate, all things to pay attention to. So we've talked about, germs on feet, on, as you said, the dirty bits, right? Butts and things like that. So that leads us to sort of thinking about grooming and bathing of our pets. And Pet Partners policy is that pets are bathed within 24 hours of a visit. And so what about bathing should we be aware of if we're thinking about zoonotic transmission, Zenny? You have any tips or tricks from the veterinary perspective on what people should really be paying attention to?
Ooh, as far as paying attention, I think that just the general rule of thumb is that your pet is well groomed and well kept when they are doing their therapy animal visits. And I think as far as good rules of thumb is just making sure that they don't look dirty and they don't have, just like when we were talking about the hands, that they shouldn't have like organic debris and like dingleberries or whatever else on them as well. So just making sure that they are free of that. In addition, again, making sure that they are free of like any ectoparasites, so there's fleas, ticks, and also people have talked about like sort of like tapeworm segments. So I think that somebody else on here had mentioned the visual inspection of worms that could be on them. So hopefully nobody is going into therapy animal visits looking like quite like that. But, in general, as far as bathing or recommendations, I think that because I think people will be concerned about bathing their animals too much, which it definitely can be in certain situations with certain animals, depending on their coat. We don't want to dry out all their natural like kind of coats and their natural oils that are healthy for them. But I think that if you pick out a very good shampoo that fits your animal nicely, and that's a good match for them if you've tested it and it's tried and true, then you can use that regularly. What I probably would recommend is also getting a conditioner, getting a nice shampoo and conditioner combination so that they will keep that coat nice and lustrous and all that. And one other sort of key point, another kind of fun fact that I always talk about especially with our senior patients, is the use of fish oils. So fish oils and omega-3, omega-6 fatty acids have great benefits for the general health of our animals. But specifically for the skin and coat, I think it helps to maintain that nice looking coat as well. So just making sure that they're clean and pretty whenever they go and are presented to people.
Excellent. So we've got a couple questions and things that have popped up, and great. I love that people are thinking about this. For both pods, but I think let's talk sort of cleanliness of your animal in general. We have talked mostly about preparing for a visit and being clean when you go in, but also what about when you're leaving, when you're done, knowing that animals can pick up things. Is it as necessary to do a full clean afterwards, or does it maybe depend on where you're visiting or your animal? Do you have any insight on that?
Yeah, I think that you hit it spot on in saying that it really depends on the situation and kind of what you've gotten yourself into and your animal and what they're willing to tolerate with all this cleanliness. So I think that if you are visiting a hospital facility, I think a good rule of thumb, I don't think that you have to get them through a full bath, especially if you haven't really visited hopefully you're not visiting fully infectious people at that time. Is number one rule is don't be visiting people with open wounds and sort of that look infectious in general. So if you've taken the proper precautions and done your hand washing and gotten all of the people who are visiting your animals hand washing and done those precautions, I think that you're pretty safe. One of the things that I think that some people do like to do is that they'll just take like kind of a baby wipe or so and just wipe along the paws, like after they leave the hospital facility, since we do have that information that their paws are a high rate of transmission. Yeah. So I don't think that it's absolutely necessary, but it's something that if people want to feel better about that, they can do that before coming home.
Yeah. And it's a great point about being judicious about knowing who you're visiting and under what circumstances and sort of what potential risk you might be coming into, which actually leads me into sort of the next thing. So we've been thinking about most of this, and most of the time I would say we probably do skew towards thinking about how can germs from animals affect people, but it can technically go the other way, right? That germs from people could potentially impact animals. So, you know, as I understand it, it's relatively uncommon, but that's a thing?
Yeah, so whenever we talk about zoonotic diseases, we're always kind of thinking about it that the animal's the culprit, that they're the ones bringing these diseases to the people. But with zoonotic diseases, they can be transmitted back and forth. And so that's when we call it a reverse zoonosis, where it's actually a human who's transmitting that sort of hookworm or roundworm and everything back to the animal. And those cases are rare. And in animal-assisted therapy and animal-assisted interventions, I don't think that we have any confirmed cases of a true infection where that has actually happened, which is good news.
Yeah.
At the same time, we do have those reports of where if we test enough, if you're constantly testing your dogs, you will find bugs on them. And so that's in part of some of the reasons for testing. When people talk about recommendations for testing for like E. coli and Salmonella and Clostridium and Campylobacter, we know that that comes with healthy animals without clinical signs. And so if we get like kind of a positive result after they visited a hospital, it's impossible to say, oh, did they get it because they were visiting and they got infected from somebody, or was that just a normal part of their microbiome and their natural body? So I think, when we're talking about those things, reverse zoonotic diseases can absolutely happen. I think that they are rare, and in animal-assisted therapies, we don't have any confirmed cases of a person actually doing that to the animal. And I think it's because we take the right precautions with what we're doing and right practices.
Excellent. So, also a chance for me to then throw in on top of that, it's one of the reasons why we really want our therapy animals to be healthy when they visit, right? We talk a lot about knowing that we shouldn't not in all circumstances is someone with a suboptimal immune system shouldn't be receiving visits sometimes. And we think the same thing about animals. Animals can have a compromised immune system, and whether from medications they're taking, they're under the weather, things like that, we wouldn't want to put those animals at risk, right? A big part of really successful therapy animal interventions is animal welfare. And, while we don't want our clients to get sick because they're receiving visits, we certainly don't want our animals to get sick because they've been providing visits. That goes backwards from what we would want. So lots of good things to consider here. I'm going to scan through. I love that people are putting lots of good suggestions around tips and tricks for grooming, for cleaning, for infection prevention with their animals. Feel free to keep putting those comments up. It's a great way to share, especially for those of you who have worked out a system that works well for you and your animal in your specific facilities. Thank you. Fantastic. So I'm going to try and scan through, make sure there's no questions I've missed. But I think we did touch a little bit about sort of what the sort of what the risk and the risk of infection is in different facilities, right? We can consider a variety of factors. Client risk factors, right? Zenny had mentioned we shouldn't probably be visiting people with open wounds and things like that, people you know are highly contagious. And especially in this day and age when everyone's really concerned about coronavirus, if there are posted precautions, the airborne or droplet precautions, that's not a space you want to be going into anyhow. There are facility risk factors as well, right? Especially right now as we're thinking about large groups of crowds may not be to your best advantage right now. Things like that. And not just with the current, virus du jour, which is COVID-19, but also I think about with things like norovirus, which gives people really bad GI issues and things like that. Where you have high volumes of people, you're just perhaps more going to run into things like that. So actually, we've got a question here, Zenny, and I'm going to ask you about a question about Giardia. Tell us what you know about Giardia.
Ooh, do we have a couple of hours?
No.
Giardia is, it's one of the most frustrating diseases, infectious diseases for us to manage. Because Giardia, for those of you who don't know, it is a protozoal parasite that affects our dogs and cats and people as well. And with that being said, it is a parasite that can cause like your traditional like diarrhea is usually the clinical sign that we have in our animals. Some animals don't exhibit any signs whatsoever. But the hardest part is that whenever we see it or we test for it, even if they have normal poop sample and everything, if it is positive, then we're generally treating them for that Giardia. And the main reason for that is because we don't want them to be, even if they're normal, we don't want them transmitting it to other dogs and other people. But the hard part about it is that it usually takes a couple of rounds of sort of the treatment options and everything to really get rid of Giardia because it is so all over in the environment. And I think that lots of the dogs get reinfected after they've cleared it because like it's still out in the yard, or maybe they lick their butt and there's still some of those cysts and everything that are on there. So it is definitely very prevalent, and especially if you're going to dog parks and things like that, it's definitely something to watch out for. And I think that, again, just taking the right precautions of just making sure that we're washing our hands. And if you wanted to take like a baby wipe to your dog's butt or so, if you're concerned, especially if you are dealing with an active infection in that way. And obviously, if your dog is exhibiting any, or your animal is exhibiting any clinical signs of like kind of soft stool, diarrhea, and all of that, then we should refrain from visiting at that time, and always check in with your veterinarian if you have questions.
Absolutely. Great, nice summary of Giardia there, Zenny. A couple other comments that come up. Yes, absolutely. Reminder of the people that, as we talked about earlier, germs from your hands can transmit onto your animal's coat. And so that's why hand hygiene before and after petting is so important. And, for those of you who are visiting and taking your animal in places, remember, you're also touching places that lots of other people touch, right? So doorknobs, light switches, things like that. So you're not immune from hand hygiene either, handlers, even though, you're like, well, of course, it's my dog and I'm not touching them or I'm not coughing into my hand, but you're probably touching other things in your environment, especially at this day and age in the current situation. Really wise to make sure you're performing really diligent hand hygiene. Here's a veterinary question for you, Zenny. Any recommendations for supplements or things that you could do to strengthen your animal's immune system? And this question was specifically for kitties, but I'll say it broadly for dogs, cats, or other pets that you can think of. Anything about making sure our animals have a strong immune system response?
Yeah, absolutely. Great question. So there are, I guess it depends on who you're asking and know whether or not you're taking a more holistic point of view or whatnot. I think that the main thing is to make sure that they are properly vaccinated, so that is going to build their healthy immune systems, that they're on a diet that is right and that's well balanced for that animal. And as far as kind of that extra boost, if you were to talk about that, I actually find a lot of probiotics to be helpful for certain situations when somebody is under distress, whether it's GI related or not. I think that we have a lot of data out there in our veterinary literature to kind of say that how probiotics really help strengthen the immune system, especially for puppies and kittens when they are getting their vaccines and everything early on. And kind of down the line, anytime that we have kind of a diarrhea incident, or if we are treating for a parasite or Giardia or something like that, I will usually recommend a probiotic also be placed on them as well. So I think that they can be helpful in a lot of ways, but I would always advise for you to speak with your veterinarian first to know if a probiotic and which probiotic, because just like any of these other supplements that we have out there, there are millions of them out there. So just finding out which one is going to be right for you.
Excellent. Thank you. So if you've got more questions that you'd like to ask myself or Dr. Ng, please feel free to put them in comments. If I've missed yours because comments have been flying past me too fast, I apologize. Feel free to re-ask. I wasn't trying to skip you on purpose. I'm not the best comment person. But a few other things here. So, Zenny, I knew this was probably going to come up, and so let's go ahead and address it now. We've got some people having questions or asking about COVID-19. Some of us have seen the reports of it being found in dogs. Can you speak broadly about sort of what level of concern we might want to have around our pets and this current virus?
Sure. Yeah, there's a lot of information that's coming out. I was just like scanning all the news and the CDC and the WHO's articles all about this coronavirus and kind of the pandemic that it is causing, because I think it's worrisome for a lot of people, because we're seeing the deaths that are coming out, and the numbers. I think it was up to like almost 90,000 that tested positive as far as yesterday globally. And even in, I guess, and you're in Washington, right?
I am.
There were a couple of people who were found to be infected and passed away, actually, who were infected with that coronavirus. And when we think about coronavirus, even though that we want to take the right precautions, and the people like around the world and everything need to be quarantined and things like that, I know that the fear came about because it was like last week that a dog in China who had been owned by a person who ended up being positive, also based on like, I think they did a nasal swab and also like a perianal swab, that dog had a weak positive result for that coronavirus. And at the same time, that dog did not exhibit any clinical signs of having flu, of having GI signs, or anything else like that. And at this time, that we're saying that it does not look like it has a true zoonotic potential to affect our animals, our dogs or our cats at this time. And so with that being said, we still need a lot more information, though. We have to kind of see like all the details about this virus and how it's spread and the details about it, because we also should know that our dogs and cats actually have a coronavirus, a different version of that coronavirus that can affect them as well. But usually those, whenever they get it, it is usually self-limiting. But this coronavirus that's a human or maybe bat originated from bats is not known to cause disease in our animals. At the same time, I think that we should just use our normal precautions of just like doing our basic hand hygiene and keeping our animals healthy to maintain those happy and healthy visits. So I think that we'll learn more as time goes on, but at the same time, it's just about keeping our pets and people safe.
Yeah, absolutely. And, you know, as some people have been commenting, and certainly this is true from the communications I've had with some facilities at Pet Partners that have Pet Partners teams visiting, certainly some facilities are choosing to limit non-essential individuals from visiting or being on site because there's so much we don't know right now. So again, this is where sort of being proactive around good communication is going to be helpful. If you don't feel comfortable visiting, if you think that there might be enhanced risk and you would prefer not to go to the airport or not go to some place where there's large crowds of people, absolutely you should do what's in your best interest and your animal's best interest and postpone those visits. Or if your facility opts to postpone visits, obviously we'd be respectful of that. We want everybody to make sure that they're feeling safe and well protected. So all of that is the same too. Absolutely. Let's see, a few comments here, Zenny. I don't know if you've got any specific suggestions for sort of wipes or disinfecting wipes for dog paws or things like that post-visit. I don't know if you, we kind of were just talking generally about wipes, but I wasn't sure if you had any specific suggestions. That question has arisen.
Yeah. Well, I think as far as those wipes go, if we're just doing them for preventative measure, I would say any sort of like baby wipe would be perfectly fine in those situations.
Mhm.
There are medicated wipes that are out there that contain like chlorhexidine or different antimicrobial sort of products out there, but I would actually avoid using those. And the reason for that is because we don't want to promote resistance in our animals with these bugs. And if we're constantly using these ones with like antimicrobials or other things, then that might make these agents a little bit less likely to be effective when we actually do need them. So I think just a general cleanser, again, making sure that they're paused, that they're free of organic debris is number one. And then I think just gentle baby wipes or anything that you can get like kind of at your supermarket would be fine.
I hadn't considered promoting resistance, but that's a great point. Thanks. So if you've got other questions you're curious about, things that we can answer, we are here to do so. But I think we've covered the majority of the topic that we wanted to today. So Zenny, while people are thinking about any last minute questions, things like that, do you have a particularly interesting animal you've ever treated as part of your work as a veterinarian, or something that is noteworthy from your experiences as a vet?
You know what? I get asked that question all the time. That's usually the number one question that I get is either what's the most interesting animal that I've ever seen, or they tell me about how they've always wanted to be a vet but could never like use an animal or so. But as far as that goes, I mean, I'm a dog and cat vet, and so every dog and cat is always like has my heart, and especially puppies and kittens of any breed of any kind. If I could be a veterinary pediatrician, then I absolutely would. But actually, I have to say that so I work here at University of Tennessee in Knoxville, and we do get to see our exotics and zoo department get to see a whole lot of really cool animals. But I think the coolest one that I have seen is a liger. So, you know, from Napoleon Dynamite, like a liger, a tiger, and lion mix, pretty much bred for their skills of magic. Well, I didn't know that they actually existed. And so, we have a wonderful large cat rescue that is nearby, and so we treat all of their animals. And so they actually rescued. They have about 3 ligers that are there, and they're beautiful, beautiful animals. And not to promote like that liger should be bred or anything else, but it was that they were able to be rescued. And so we were treating this one for some skin disease, some topical skin diseases, and all of that. So that was a pretty cool one. That to say that I didn't really know that those existed. I thought it was
amazing.
My thing. So that's cool.
Very, very interesting. All right, well, you break the internet for today that you've met a liger. I can't claim the same. Very, very nice. So a couple last minute questions, and if you want to get one more question in before we wrap up today, please feel free to type in the comments. A question. This is actually a great question. Somebody asked about: are there benefits to dry shampoo in place of an actual bath for pets?
Oh, that is a great question. So I think that if you, and I use dry shampoos for kind of spot treatments in a lot of those situations. So I think that if your animal is overall pretty clean, like again, like they're free of dirt, debris, anything else on them, I think that those dry shampoos are great because they dry pretty instantly. They're like kind of a foaming sort of wash, and especially if it's kind of a spot cleaner or anything else, then I think that they are great. But it's not going to get a deep clean, of course. So just making sure that if they are truly dirty, that they are bathed. But I think that those spot shampoos are great.
Excellent, excellent. Let's see. Some more comments about COVID-19, which is great. Questions about whether there'll be a vaccine or even a dog vaccine. I suspect it's too early to say, right?
Yeah.
Unless you have some insight that we don't have, Zenny.
No, that not to my knowledge, and especially if it's not going to truly be affecting dogs and dogs aren't going to be clinically affected, then probably not. But we can go into, I have an entire story about the dog flu itself. So H3N2 and H3N8 that kind of came about. So we had a surge of it in the beginning of the 2000s, and then H3N2 just came up a couple of years ago and again caused this sort of pandemic. But now it seems to be kind of at bay because people are kind of understand the disease better, and we do have a vaccine for those. So, but with this one, I don't think so. But yeah, I think we'll know in the future.
Very good. Very good. Well, I want to thank everybody who joined us today. And I want to particularly thank my guest, Dr. Zenying, for being the source of all sorts of great information about infection prevention, about zoonosis. We want you all to make good choices out there about what keeps yourself, your animals, and the people that you come into contact with healthy. Go out there, wash those hands, use your hand sanitizer. Don't visit if you're not feeling well. Don't visit if your animal's not feeling well. And if what's right for you right now is to suspend visits because of COVID-19, you should do that. So thank you to everyone who's joined. We're really appreciative. You can send any other questions. If you think of something, don't hesitate to send a direct message to Pet Partners. We'll be happy to answer any questions we didn't get to today. Zenny, thanks again. Such a pleasure to have you with us.
Thank you for having me. It was great. All right. Bye, guys.